President Duterte kept out of the public eye for several days and canceled his regular briefing twice last week. And last night, the president showed up during his public address in Malacañang. Our Trisha Terada has the details. Trisha, good morning. Did the president explain his absence in the past days?
Yes, Ria, good morning. President Duterte denied speculations that he is sick. He says going out of the public sight was intentional. The chief executive was supposed to have his regular talk to the people last week, but it was canceled twice. Why? Here's the president in his own words.
Nawala ako ng ilang araw. Talagang sinadya ko yun. Ganun ako eh. Pagka kinakalkal mo ako, lalo akong yung parang bata. Pag lalo mo akong kinakantsawan, mas lalo akong gagana.
While the public has been wondering about his whereabouts, the president says he has been staying at the Malacañang residence, busy with work, particularly with agriculture issues. President Duterte also addressed criticisms against him for golfing, jogging, and riding a motorcycle around during wee hours. He particularly called out columnist Montulfo for taunting him to show up on national TV to dispel rumors about his health condition.
If you want me to die early, you must pray harder. Actually, what you intend or what you would like to happen is to see me go. You want me to go and you're praying for that. Alam ko, kinakantsawan ako ni Montulfo nito. I cannot be, sabihin mo na itong isa, nasaan ang presidente? You know, baka patay na. Sabihin ko sana na, nandito lang ako sa Malacañang, natutulog ako, mag-isa. Ikaw, sino ang kasama mo sa kama? Ikaw ba ang may-ari niyan? You know, it takes two to tango. Pag binabastos ninyo ako, hindi babastosin ko rin kayo.
The president explains he does these hobbies during the wee hours to avoid wasting the people's time and resources. Back to you.
Trisha, speaking of criticisms, why did the president lash out at Senator Laila De Lima last night?
Well, basically, the president recalled De Lima's criticisms and her alleged involvement in drugs. Mr. Duterte is accusing Senator Laila De Lima of being too greedy in hopes to become president.
Magtiis ka. Binastos mo ang Pilipinas ng druga dyan mismo sa National Penitentiary. Ngayon, sige kayaw-yaw dyan kung ano-anong pinagsasabi mo na hindi ko kaya. Bakit? Ikaw ba ang nag-elect sa akin? Matapang pa magsalita, kanang masino. Tatagal kaya ako dito sa pwesto na ito kung inutil ako? Would the military allow me to govern ganon? Palampang pamalakad mo? Wala kang ginawa?
The president dedicated more or less 10 minutes of his address attacking De Lima, but De Lima was quick to respond, appealing to the president to focus on the crisis. In a tweet, De Lima said, quote, "Mr. President, maawa ka naman sa taong bayan, namamatay na ang mga mahal nila sa buhay. Ako pa rin ang problema mo," unquote. Back to you, Ria.
All right. Now, Trisha, where are we in terms of COVID response? And do we understand this right, that the president is waiving his slot for the vaccine?
Yes, correct, Ria. The president says he wants to prioritize those who can make more use of it at his age. He wants a slot to go to someone who will live longer. He encourages the public not to worry about running out of medicine or vaccines. After all, he says it's not only the Philippines that experiences this. Health Secretary Francisco Duque says the government is looking after healthcare workers. One step is getting them checked every 2 weeks. National Task Force Chief Implementer Carlito Galvez reported that public and private hospitals have committed to expand their capacities by up to 164 ICU beds and at least 1,157 beds for moderate and severe cases. Galvez says this is the result of PhilHealth's commitment to pay up 9.55 billion of claims by hospitals in Metro Manila, Region 4, and Region 3. President Duterte directed Galvez to add more beds for COVID cases. With more than 100,000 active cases, Galvez says there's a need for 2,000 beds for severe and critical cases. There are currently 1,395 beds. The government also needs 605 more ICU beds, but the long-term goal is to have at least 2,000 ICU beds available, according to Galvez. President Duterte advises government officials not to be afraid to spend so long as they follow rules. He assures them of his support. Besides, he tells PhilHealth President Dan Tigueran now is not the time to tighten up on spending since there's an urgent need to buy beds. Over to you, Ria.
All right. Thank you a lot for that, Trisha Tirado there reporting.